So the amyloidosis diseases are actually a set of diseases that can be blood or bone marrow disorders in the most common form, but there are also genetic diseases and diseases that occur secondary to other conditions like chronic infections and chronic inflammatory diseases. So they really span a broad spectrum of medical care, and in fact we've developed a multidisciplinary program to take care of patients with amyloidosis. But my interest is in what really is the most common type of amyloidosis in the United States, which is AL amyloidosis, also known as primary amyloidosis. And the same applies to Dr. Sanchorwala. So we are hematologists, and because that particular form is a blood disorder, over many decades of research here and elsewhere, we've learned that these diseases can be treated with chemotherapy to affect cells in the bone marrow, and we consider the disease to be a cousin of a more common blood disorder, multiple myeloma. So our treatment approaches are based on what's used for myeloma, and over the years we've developed a program here that includes chemotherapy and stem cell transplantation as a major modality for treatment.
For me, chemotherapy proved unsuccessful. So after careful thought and deliberation, upon my doctor's recommendations, I decided to undergo a stem cell transplant since it provided the best chance of a durable remission.
So stem cell transplantation can be used for many hematological diseases as well as some autoimmune diseases. The stem cells are parents which reside in everybody's bone marrow. We stimulate them so they come out from the bone marrow into peripheral blood, and we can harvest them from the peripheral blood. We can also harvest them directly from the bone marrow, and that is known as bone marrow transplantation. When we harvest them from the peripheral blood, it is known as peripheral blood stem cell transplantation. The donor can be either a patient or a sibling or a relative, or from the donor from a national marrow registry. When donor is not the patient himself, it is known as allogeneic stem cell transplantation. When the donor is patient himself, it is known as autologous stem cell transplantation. The disease that we are very expert in here at Boston Medical Center is amyloidosis, and we usually use peripheral blood autologous stem cell transplantation. The donor in that case is patient himself or herself. The purpose of stem cell transplantation is to able to deliver high doses of chemotherapy safely and effectively. And the use of peripheral blood stem cell transplantation makes this delivery of high doses of chemotherapy safe and possible.
This excerpt is brought to you by the Massachusetts School of Law, a leader of reform in legal education and a leader in multimedia education for the public. To view the full interview and for a full listing of MSL's programs, log on to mslaw.edu.